The Winnipeg Regional Health Authority has reminders that vaccines are safe and effective against many diseases, including polio, meningitis, and measles. These diseases can be deadly and are preventable with vaccines, but many people are not up to date on their immunizations. This week is National Immunization Awareness Week. Joining us now with the WRHA's Medical Officer of Health is Dr. Bunmi Fatoye. Good morning.
Good morning.
So at a very basic level, and obviously you're the educator here, how do vaccines work?
Well, vaccines work by actually creating antibodies in our body to fight against the disease that the vaccine was created for. So what we do is that we inject our body with a killed form of the vaccine, an inactive form of the vaccine, and the body, our immune system recognizes it as a foreign body, and it mounts an antibody in response to that antigen to provide that immunity for us, so that when we actually face that vaccine, the disease or the virus in real life, we have that protection. The antibodies already exist in our body to fight that infection.
We're seeing in Ontario that there are cases. Here in Manitoba, what's the scope?
Well, luckily in Manitoba, we haven't seen many cases of measles. We've seen in total, we've had about 10 cases. These are all cases that were acquired outside of the province. And so we've used that time to educate the public, to make sure that people are up to date with their immunizations and also take precautions if they're traveling to areas where the diseases are endemic.
When you say educate the public, there's certainly a lot of misinformation out there. How do you guys combat the misinformation when you're continually providing it? And what are some things that you want the public to know?
What I want the public to know is that there are trusted sources of information. This could be their healthcare provider. This could be someone they trust in the community. And I'm really encouraging them to reach out and have those conversations. I think immunization is important in all stages of life, from when we were born to when we actually leave this earth. And so it's important that we have encounters with our healthcare providers, and we constantly talk about immunization. It's important. I want people to make it a conversation. Are you up to date? Have you got your necessary vaccinations? You know, we celebrate 50 when you turn 50, right? We have birthdays. Oh, there's some things you have to do when you're 50. You know, those are important conversations to have.
And people forget too, right? So going back and making sure that they're tracking these things for themselves and their children.
It's very important. You can get your immunization records either by talking to your healthcare provider or even reaching out to the government. There's a website. You can actually email and they can send your records to you. You could also contact a local public health office and they can help you get your records. And now take those records and have a conversation with your healthcare provider or a trusted person that you trust, and ask yourself, what is missing? What do I need to get? What do I need to get up to date with?
I understand that there's going to be a building lit up for the week. Explain.
Yeah. So we wanted to bring want to bring more attention to the importance of immunization. So we are collaborating with the city. So the Winnipeg sign and the Esplanade Rail walkway will be lit up today, from dusk to dawn, to really bring attention to the importance of immunization. So if you're out and about downtown in the evening, you know, you can get a photo or something, and you can post it. National Immunization Awareness Week.
And when you see it, now you know.
Yes,
That's it too. Now you know.
Yes.
Thank you so much for your time, Doctor. We really appreciate this.
You're welcome.